Hello, I'm David R. Jones of the Community Service Society. Welcome to the Urban Agenda. This year's Community Service Society survey of low-income New Yorkers confirms what we as an organization know very well and confront each day. Life for New York's working poor families is getting substantially worse. The research was conducted by the Lake Research Partners. Joining us today is Dee Brown, the senior analyst at Lake Research Partners, who worked on the research. Welcome to the Urban Agenda, Dee.
Thank you, David. Thank you for having me here.
First, I'd like, with Dee's help, to talk about some of the top-line findings that we found, and they are serious hardship for the working poor, such as falling behind in rent, inability to fill a prescription, or postpone medical care, climbed by 30 percentage points over the last year. Among poor full-time wage earners, half are now uninsured. 34% had their hours on the job reduced. And the majority of low-income families have at least one member of the family who is employed. More than 50%, however, have less than $100 in total savings. And Dee, this is not just a small group of people we're talking about. In New York, this essentially represents about 1,700,000 in people. Big chunk of people. Mm-hmm. What's going on, Dee? I mean, we're starting to see at CSS, or get the feeling from our perspective, that people are seeing downward mobility rather than the other way around. Is that what you're seeing in terms of your other national surveys and the rest?
We are seeing that there's a lot more misery being spread out across the country. People are, stagnant wages, rising housing costs, gas prices have all contributed to people not being able to do what they used to do with the same salary. They can't make ends meet. And something's got to give. So sometimes they can't pay the rent, sometimes they can't buy food. Now, for most of us, that's problematic.
And why do you think, I mean, we were talking about this, we were really shocked with how sharp the increase was between our last year's survey, which Lake Research Partners conducted, and this year's. What do you think's going on here? Are there more people becoming poor, or what's happening to the people who are already poor? Are they having a harder time?
People who are already poor are having a harder time, and people who were just perhaps near poor, who were just hovering above it, are now closer to that poor, to that line, because they can't make ends meet. They may not qualify for a specific government program because they're above the line, but yet and still their expenditures have made them, fall behind in a lot of these areas. And one of the things that we're seeing across the board is not just that more people are having hardships, but the same people who've always had hardships are having more problems. Like, in other words, at one time it was just, okay, I can't pay my rent and I might not be able to buy food. But now it's, I can't pay my rent, I can't buy food, I can't buy prescription medicine, I can't buy school supplies, and I've had to go to a charity organization. I mean, it's the level of multiple hardships that people are overwhelmed and overburdened at this point.
Give the audience some sense of how this survey is conducted. First of all, are these very common to do surveys of low-income people?
Not really. Most of the surveys that are done are just done, representative of their geographic area, and very few actually go in to look at specific subsets of population within a geographic area. And one of the things that we've done here is really give a voice to those who generally are either excluded because, it takes more time to reach them because they're a harder to reach population. Or that their numbers are so small within a full survey that they can't be looked at adequately. Right. And so what we've done is given a voice to what we call the unheard third. Mm-hmm.
And tell me, how does a survey, how is it conducted? What happens when somebody, how do we talk to people? I mean,
well, they are reached by telephone. Even though that they may be low income, most people in this society do have a telephone. Mm-hmm. And sometimes it takes a little bit more to find them because we want to make sure that we're looking at people who only make a certain amount of money. So we use census tract information. and overlay that so that we know we're calling in areas where people have a tendency to have less disposable income. And we call and we have to assure them that this is not a situation where we're trying to find out any information about them or trying to use it in any negative way, and then we're not selling them something and that kind of thing. And but once they understand what it's about and what it's for, they really want to participate because they, this is their opportunity to say what they have to say.
And we also do some oversampling of moderate and upper income. First of all, how is that done and why?
Well, in order to, we want to be able to compare between those who are, low income and those of moderate and higher income. So we also do an oversample. And mind you, when we say oversample, we're talking about it's roughly the size of an additional poll. And so what we do is we combine the two, and this is a kind of technical jargon, but we weight them down so that we can actually get a part of the survey and look at it as if it's representative of the entire city in the rates in which they naturally occur.
In terms of their economic condition.
Yeah, and so that it's, so one is looking at it just as New York City residents,
right?
And then another way is looking just at the low income, and we can also look at just at moderate and higher income.
We have obviously at the Society and discussions all over the place been talking about the hurricane's impact on New Orleans and whether there was going to be a major sort of reanalysis and a relook by the country about poor people. What do you think this poll indicates for that? First of all, I'm interested to get your viewpoint as a national pollster about, do you think this is still a live issue for people? Is the Katrina and the devastation of New Orleans poor still in the sort of front of everyone's mind?
Well, I don't know. I see it waning. It's not as it was, it's not as much interest as it was, and I don't see it on the cable networks as much as I did in the immediate weeks after the hurricane. And I think with the new hurricane coming around, Katrina may disappear altogether once we start talking about Wilma. But I do think the attention on the poor was it was gut-wrenching, but people will quickly try to focus on something else because no one wants to focus on those images. And to the credit of the American people, they are so overburdened with a lot of issues. They're worried about terrorism, security. They're worried about public schools. They're worried about retirement. And there's so many pressing issues on their agenda, okay? And sometimes they just don't want to add anymore. And with looking at the horrific images of Katrina, of course, how can that be ignored? But once it starts to leave the front page, it will be easily put aside for other things that's coming down the pike.
And do you think race had an impact in terms of how quickly this has been put aside?
I think race has an impact in people's focus on poverty and poverty reduction measures. I think for the last 30 years, we have tried to paint the poor as somehow undeserving, having participated in bad behaviors, and so therefore this is the bed they've made and they should lie in it. And we've talked about personal responsibility that can often mean you're on your own. And so we've learned to ignore them and be justified in that, ignorance because just somehow it's these people's fault. And one of the things that happens is that we stereotype the poor and we put a black face on it, and people said, and so all the other stereotypes that come along with that racial baggage that's been part of the American psyche for some time is attached to that. Then we see something like Katrina, and although our hearts go out to the poor, the face was once again black. And I had someone say to me just the other day, well, what about all the poor people in Appalachia? And I said, well, they don't make primetime news, so they don't exist.
It's interesting, some of the assumptions people had about New Orleans poor, and actually about New York poor. For instance, one of the big things you hear, well, these people are on welfare. Our sampling seems to show a completely different picture.
Absolutely.
These are virtually all working people.
It's a large majority. I believe it was somewhere near 70% that had at least one member of the family who was employed. And there are other factors that come into it. There's a large percentage when you ask those who are not working, what are some of the biggest reasons they're not working? They're being laid off. Okay? So this is not their own fault. They're not just choosing to stay home. And then there's a huge percentage where, because they're dealing with serious health issues.
Right.
Okay? And they're disabled. And we have not taken any of that into account.
We actually know that because we issued a report now quite a while ago on the number of black men, particularly who were not in the workforce. And when you dig into it, you know, you start to understand, and I'm feeling particularly sensitive being seriously middle-aged now, that a lot of both Latino and African American males who didn't get skills but worked their entire lives suddenly enter their late 40s, early 50s, and they suffered a ruptured disc, and they can't find work anywhere. No one will give them a chance because either they will not consider the health insurance consequences, and they can't lift anymore. So this has become something that we have to re-educate the public about. We'll be right back to continue the urban agenda.
Just close my eyes and I'm with you, and all that I so wanna give you, it's only a
You don't have to be a hero to be a hero. When you adopt a child from foster care, just being there makes all the difference.
We're discussing this year's Community Service Society survey of low-income New Yorkers and are joined by Dee Brown of Lake Research Partners. Dee, let's talk about some of the specifics actually about what the polls seem to have indicated that were stunning to me anyway, and I think most of us. One of the things that seem to be coming out is real trouble accessing health care. Can you tell us a little bit about what seemed to be coming out of this poll and your others?
Well, on a variety of levels. One of the things that's happening is that about a third of low-income workers, and these are all people who are employed,
right,
have absolutely no benefits from their employer. And that includes things like health care and prescription drug coverage, as well as sick leave and vacation leave and other things. So a full third have no benefits at all. But aside from that, I think it's somewhere like 11%. That's like 1 in 10 poor workers actually has health coverage.
Of any sort.
Of any sort. Even fewer have it from, prescription drug coverage from their employer. So we're talking like, 1 in 10 may have it. So where do they go? I mean, if they're eligible for safety net programs, okay, fine. We don't know that they're eligible, 1, and 2, if they're eligible, if they know about it and are able to access it. But we know that people typically think when they go to work, they should have some kind of benefits, and they're not getting them.
One of the problems, obviously, about people who are dealing with safety net programs, particularly if they're not insured at all, and it happens particularly for immigrants. When I was on the board of the Health and Hospitals Corporation of New York for many years, you'd find that people who there's a guarantee in New York, unlike many other cities, that no matter what happens, you can always go to a municipal hospital. The difficulty is that people wait until they're in extremis, so they don't get normal treatment. So if you've got uncontrolled diabetes or you've got asthma, you generally come in crisis. And it does two things. You get much sicker. It costs everybody huge amounts of money, and people suffer a lot because of it, rather than having this sort of support. The other thing, however, and I think we've talked about this, is the fact that even when employers offer insurance, many of the low-wage working people can't afford it.
Absolutely, and this is not just here in New York. This is a national trend across the board. Employers have reduced the level of subsidy of these insurance programs that they're offering. So even in companies that are offering their low-wage workers insurance, if they have to pay 50%, so we're talking maybe $500 a month, something like $250 per paycheck when you only make $350 a week is not.
You can't do it.
You can't do it, and so and they're no longer offering a lot of them any kind of subsidy for family coverage at all. So people are really being priced out of it and can't afford it. Or they're in a situation where they're working, because this is one of the things we've seen in New York, a huge increase in the number who are working part-time.
Right.
And not by choice. This is all they can get. They would rather be working longer hours. And because they're part-time employees, they're being not eligible for whatever benefits are being offered as well.
We also saw out of the data an indication that basically, and I don't think most New Yorkers know about it, that many, if not most of these workers have no time off whatsoever. And that includes being sick. They don't even get time off for being sick.
They don't have paid sick leave. They don't have paid vacations. And, we've had a lot of discussion lately about, retirement and Social Security. Fewer than 1 in 10 has any kind of pension or retirement plan at all. So we're either going to pay now, we're going to pay late, and we're going to pay later as well. And you brought up something you talked about is prevention. We're not a prevention kind of country. We didn't all of the things that we talk about are things that we need to put in place to educate people for the transition, to retrain people for for different jobs. We have not done anything, so now people are paying the price, and there's just a lot more misery out here.
We did a somewhat smaller sample, and I wrote a series of articles, actually. We became concerned. We have a large senior volunteer program, and we were hearing more and more stories of seniors, some of whom were volunteering, but some of whom weren't, who were relying on Social Security as their sole means of support, which is not much money. And we believe, among cities, one of the largest concentration of elderly, particularly immigrant, Latino, African-American elderly, who that's their sole or primary source of income. And what's happening is many of them are being forced back into the labor force, not because they are feeling healthy and spry, but because in order to survive, they have to do it. And it's actually having a really paradoxical impact of younger workers being pushed out by older, not because they want to do that, but because they have no option. They have to take a part-time job in order to make the rent.
And just to highlight what you're saying, one of the things that we found last year when we asked people what was the main reason why they weren't working, those who were unemployed, the top response was retirement.
Right.
Okay. This year, the top response is laid off. Okay. Retirement has dropped to like 3 or 4. Yeah, because people are not retiring; they can't.
What about the housing situation? I mean, we talked early in the program about housing. What seems to be the indicators coming out on housing?
Well, housing. Well, what we found in the study is that there's 2 New Yorks that are emerging. And one of them is low income and focused on affordable housing. Right. This is, not unexpectedly, with rising costs. New York was not the cheapest living market in the first place. Right. But, the increased cost in housing has people at their wits' end. And so this is their mantra: affordable housing, affordable housing, affordable housing, because they can't. I think they're paying something like 65% are paying over half their income in housing costs.
And we did a sort of back-of-the-envelope estimate that this leaves an individual after housing earning this in this wage rate about $30 for all total costs. That includes food. Subways, last time I knew, were somewhere a little less than if you get a packet, you're still paying $1.90 each way. They're $30 for it does not equate.
Exactly. These people are not making ends meet, which is why you see at the other end the higher level of multiple hardships that they're facing, because they're going without basic needs like food and medicine in order to be able to keep a roof over their head.
I've been surprised. Sometimes I have to struggle with people to understand that this exists. And even when they're coming out with the numbers themselves, we have now one of the highest numbers of homeless that we've ever had in the city's history, nearly 40,000. And we also have an enormous dropout rate of youngsters. It now estimated by the Chancellor of the City of New York that less than 10% of African American and Latinos actually graduate with a Regents degree, and 50% plus drop out totally. And we haven't even sorted, for obviously really poor kids. But somehow these issues, I get, oh, that can't be true. I mean, the unemployment rate or the disconnected employment rate, in other words, that black men are out of the workforce. Oh, that's not true. That can't be true. And yet the next statement will be, but we know that virtually everyone drops out of school, and we know that we have the highest rate of homelessness, and it's like we're talking statistics that they don't seem to put together.
Well, we've had some history here in this country of not being able to connect the dots. So
right.
It's one of the things that, but I will say that perhaps there are those who don't, but the general public in New York kind of gets it.
Yeah.
They support overwhelmingly in favor of increased funding for training dropouts because they know, where are our future people going to come from? Where's the workforce going to come from if we don't get these kids trained to do something specific? This can't continue, and so they definitely support it.
One of the worrisome things, however, apparently beyond what happened last year, it seems there's a lot of voter disaffection among our core population. What's going on here? First of all, did you see that in the data?
Yeah, there is some voter apathy, and some of it has to do with people buying into it. People have believed, like in 2000, they came out to vote. We told them, get out there, have your voice heard, have your voice counted. And then they saw the Supreme Court do something finagly quite not correct. Couldn't put their finger on it, but they knew it wasn't right. And so that kind of disenchanted a lot of people from the system. Then in 2004, it doesn't quite happen the same way again. But they're hearing stories about, ballot boxes that are not working and, people not being counted properly. And it only takes about 2 or 3 stories to get through the populace for them to begin to say, my vote doesn't count, why bother?
Now, one of the myths that also seems to be challenged by this survey is who's suffering most in this city. It was assumed that, basically, must be the people who have just been sitting around generation after generation. Actually, your findings seem to indicate a totally different kind of poverty problem in the city of New York.
Absolutely. We've had this myth for some time that immigrants come to this country and they get handouts from the government and they take our jobs and this kind of thing. Well, we found in this survey, those who most likely to have 3 or more or even 5 or more hardships are Hispanic immigrants. Okay, they are so when you look at that misery index, okay, they are the most miserable. Okay, now this is not to say that other people aren't suffering as well, because they are.
Right.
But what I just wanted to be known is that they're not, they're doing jobs, but they're suffering. They're not making any more money than anybody else, and they're paying
really
for coming here.
My thanks to Dee Brown, Senior Analyst with Lake Research Partners. I'm David R. Jones of the Community Service Society, and thank you for watching The Urban Agenda. To learn more about the work of the Community Service Society of New York or to comment on the Urban Agenda, please contact us at 212-614-5425 and on the web at www.cssny.org.